As Mom got older, I wasn't sure how she would cope on her own. She had a fall recently and couldn't get herself up off the floor or reach the phone. Fortunately, her neighbor dropped by soon after and was able to help. But what if she hadn't come by? All I could think of was Mom lying there, frightened and alone. I know Mom wants to stay in her own home, but I need to know she can get help if she needs it. Let's face it, life rarely goes to plan. The older she gets, the greater the risk of sudden ill health. An accident, heart attack, stroke, or fall requires immediate medical attention. I can't always be there. That's why I called INS LifeGuard. They provided an alarm system with a small, discreet transmitter, which Mom can wear as a pendant or on her wrist like a watch. It's waterproof, so she can even wear it in the bath or shower where she's most at risk of falling. They also have fall sensors and various other call buttons that can be installed. Simply pressing the Help button sends an alert to INS LifeGuard's Emergency Response Center, where a trained nurse will respond. They'll first try to make voice contact to determine whether Mom needs help. Based on her response and medical history, they'll summon assistance immediately. This could mean calling a neighbor, friend, or family member, or summoning emergency services. Sure, there are cheaper non-monitored systems, but they rely on family or friends being available to respond at the time Mom needs help. With INS LifeGuard, an experienced nurse is always available to assist, 24 hours a day, 7 days a week. The fact that all calls are answered by qualified nurses is unique to INS LifeGuard, and that was important to me. Emergency personnel can be engaged quickly if required, and the nurse can share medical information that could save a life. Mom can call LifeGuard's friendly staff for a chat at any time of the day or night, whether she's got health-related questions or is just feeling lonely. In fact, they encourage her to let them know when she's unwell so they can regularly check on her. Better a nurse manages her care than to wait for an emergency to happen. If she does need to go to hospital, they'll check on her again when she's back home and ask her to send a test alarm for reassurance. Now Mom can stay independent and remain living in her own home. And I have peace of mind knowing she can contact a nurse whenever she needs to. Mom has diabetes, so we also chose their optional telehealth service. A registered nurse monitors her vital signs remotely and conducts a monthly nursing review via audio-video call. The results can be automatically sent to her GP or specialist with Mom's permission. And their secure client portal is free, so Mom or I can log in and update her personal or medical information whenever we need to. For us, INS LifeGuard was the answer. Give them a call on 1-800-636-040 or visit the insgroup.com.au for more information. With INS LifeGuard, Mom's in good hands.